Do you find yourself running to the bathroom? Maybe you get home and as you get in the house you leak. Or as you're trying to get your drawers down, you end up leaking. Or you find yourself knowing where the bathroom is everywhere. You're like, I know the grocery store, here's the bathroom. Or you find yourself just in case peeing all the time before you leave the house to go somewhere, before your exercise class starts. You're just urinating a lot. That is called urinary frequency. And that is when someone is urinating more than 7 times a day. My name is Nari Clemons. I'm a certified pelvic rehab specialist, and I'd love to talk to you a little bit about what bladder retraining is and why you may be seeing a pelvic therapist for this, and the fact that it actually works. There's all these medications out there for bladder urgency, and if you watch daytime television, you can't make it through a program without hearing about them. But the problem is there's a lot of side effects with these medications. Okay, let's go through the list. They're constipating. They create vaginal dryness. So if you already have vaginal pain, or if you have low estrogen in your vagina, if you're postmenopausal, it's a whole nother thing. You should watch one of my videos on why you should have estrogen put in your vagina if you're postmenopausal, but that's another topic for another day. They're drying to your vagina, so sex can be more painful. They also are linked with increased cognitive confusion, disorientation, and they also can create balance impairment in elderly patients. So these medications are called anticholinergic medications. And the problem is there's other medications that are also drying, like some of the allergy medications out there, some of the medicines for nerve pain out there, some of the medicines that help us with mood and mental health. And so the more of these anticholinergic medications that you put together, the more your side effect profile is, and the more there's cognitive side effects as we get older. So there's a lot of reasons not to want to go that route, and here's the great news. Bladder retraining has been shown in clinical, high-quality research studies to be just as effective as the medications. There's this misperception out there that because something is common, it's normal and it needs to be accepted. And I'm here to tell you as a pelvic therapist, just because it's common for people to leak when they sneeze, or it's common for people to have to go to the bathroom very often, that does not mean it needs to be accepted and that there aren't things that can be done about it. So what is your pelvic therapist going to do about this when you see them? There's a couple parts to this. So one thing is the bladder, it's a habit. It has habit. So think about when you have a cold or a virus and you go a few days where you can't eat as much, and then you go back to eat and your stomach feels really full. When you've gotten in the habit of emptying your bladder often, your brain and your bladder will perceive that it's full before it's actually full. Then it starts giving you signals to empty more often. So then if your bladder is emptying more often, it starts to think, oh, this new volume is full. And so then you empty faster. And so this cycle keeps going on and on and on. It's normal for your bladder to hold 16 ounces of fluid. So that's like a medium Starbucks. So one thing when we do your bladder retraining is we have to retrain your bladder to have a different perception of when it's actually full. We don't want the bladder to think it's full at 10 ounces. So how do we go about this? Well, one thing is we have to calm the bladder down. So there are foods that are irritating to the bladder. It's especially some of the drinks out there. Stimulants like coffee are really irritating to the bladder. Alcohol, artificial sweeteners. For some people, dairy, citrus, sugary drinks, and that includes juices, and then carbonated beverages. So all of these foods, those stimulants and acids are kind of like the most irritating. All of these foods can contribute to bladder irritation. And what does that do? So there's this relationship. There's a pelvic floor that controls when the bladder is supposed to empty, and then there's the bladder on top of it. And all of those irritants make the bladder contract more and more and more. They irritate the lining of the bladder, and then the bladder is like, get this out of me. I don't want this in here. And so what that does is it makes the bladder contract more, and it gives you more of a sense of urgency. So one thing we need to do, sometimes in the short run, sometimes in the long run, is start to look at those irritants, and maybe you don't have to give up everything, but decrease the amount of them. Now there's a couple of little things to keep in mind. One is that the more concentrated of that irritant in the bladder, the more it's going to make your bladder overactive. So for example, if you have a little green tea and you've already had 12 ounces of water that day, the concentration of caffeine in your bladder is low. But if you have a triple latte, like a grande, now you have 3 shots of espresso sitting in your bladder. And remember we said acid and stimulants are irritating. So now you have acid plus stimulant and a lot of both sitting in your bladder. If you haven't had any water yet that day, your bladder's already irritated. So I'll make a whole separate video talking more about bladder irritants, but just understand that these are the things, like the amount matters, and the more of them combined you have matters. The other thing that we want to keep in mind is that water helps flush the bladder. Now, LaCroix is not water, Diet Coke is not water, water is water. Green tea is not water, water is water. So when you have water flushing your bladder, that's going to help to calm it down and soothe it. So if we have more water and less irritant, the amount of irritation to our bladder will be less. One of the other things that we find happens is when people have urinary frequency, they're tired of having to go all the time. So they keep cutting back on their water. Well, now the urine in the bladder is more concentrated. And even if they don't have irritant in it, just concentrated urine by itself is irritating to the bladder. And so then that bladder keeps becoming more irritable. Similarly, you know how if you urinate first thing in the morning, your urine's more yellow, it's more smelly, because that's concentrated urine. And so your bladder by morning is already a little irritated because it had all that concentrated urine in it all night. So if you can get in 16 ounces of water before you start your coffee for the day, you'll at least flush the bladder and the lining will be a little calmer before you hit it with stimulant. Now I have other videos on this channel about baking soda and pumpkin seed oil. Those are 2 really, really helpful little cheats we can use to calm down the bladder. So you can check out those videos because those can be really, really helpful. But this video will get too long if I try to talk about those. So we need to calm down the lining of the bladder. What does that do? The bladder's less talkative. Then, if it's less talkative, maybe we can start to get it to stretch more. So we start to look at the intervals. How often are you peeing during the day? Are you going every hour? Are you going every 45 minutes? Are you going every hour and a half? And then we look at the average interval and we try to increase it by 15 minutes. Now there's little strategies we can use, little tricks we can use on how to make that bladder calm down a little bit more. I'll make a separate video on that for you so you can look for urge suppression strategies. That'll be another video I have for you on this channel to learn about that. But between the urge suppression strategies and decreasing the irritants, then we can start to work on increasing the intervals between voiding. So say we've been going every hour, we can start trying to go to the bathroom and then set a stopwatch and try to make it to 75 minutes for the next week or 2. Sometimes friends, you're gonna have to wear a pad in between, just a little one, so that you're not so worried if you're out in public that you're gonna leak and have wet pants. So sometimes I encourage people the first day or 2 that they're moving to a newer interval just to go ahead and wear a pad, even if they don't normally wear one, so that they're not thinking they're gonna leak and then not making it to the next interval. So these are some of the things your therapist can work on with you. They can help you tease out your diet more. And then also they can assess your pelvic floor muscle strength and see, are your muscles always tight? Is that why you're constantly having urge? Do you have a C-section scar or another scar above your pubic bone where the bladder doesn't have room to fill and stretch because it's being held down by that scar? Are there some urge strategies? I'll talk to you about them, but so often when people think that they're doing a Kegel, they're actually bearing down. So you want your therapist to check what's actually going on with my pelvic floor. When I think I'm trying to hold, am I actually doing the things that will help me hold, or am I doing the things that would actually promote me leaking, or in a worst case scenario, promote prolapse in time? So these are some of the things that you might expect that you can start to work on if your doctor has mentioned you have urinary frequency, or if you know that you're going to the bathroom all the time. Again, check out some of the other videos on this channel to learn a few more things, and hit that subscribe button if you want to keep learning more from me. Thank you.